Scientists may have just cracked the code on making semaglutide, the active ingredient in Ozempic and Wegovy, bigger and better than ever before. They've created a new supercharged combination drug called Cagrisema, and it's delivering some of the most impressive weight loss results we've seen for medication to date. Hi guys, I'm Dr. Kidd. I'm a general practitioner from Australia, otherwise known as a family medicine physician if you're from the US. I've helped thousands of patients with weight loss, and in this video, I'm going to break down exactly how Cagrisema works and what specific changes scientists have made to make it so much stronger than the original semaglutide. I will then compare it to the existing medications semaglutide and tirzepatide, and then answer the big question: is Cagrisema the best one of them all? To understand what makes Cagrisema special, let's review what we currently have available first. Semaglutide, found in Ozempic and Wegovy, is a GLP-1 agonist. It works by mimicking a hormone in your body called GLP-1 that's naturally produced to regulate blood sugar and appetite. Tirzepatide, found in Mounjaro and Zepbound, takes a combination approach. It's a dual GLP-1 and GIP agonist, targeting two different hormones in our body that regulate appetite. Now enter Cagrisema, which represents yet another combination strategy. Unlike tirzepatide that combines two incretin hormones, Cagrisema combines two completely different active ingredients that work together. The first element is semaglutide, the GLP-1 agonist that's found in Ozempic and Wegovy. The next element is called cagrilinotide. This is a newer compound that acts both as an amylin and calcitonin receptor agonist. Now let me break down what amylin and calcitonin do for weight regulation. Amylin is a natural hormone produced in your pancreas alongside insulin. It plays a crucial role in weight management by slowing down how quickly food moves through your stomach and also sending powerful satiety signals to your brain. Calcitonin is traditionally known for regulating calcium and bone metabolism, but research has shown that it also has significant effects on appetite control through receptors in the brain. So Cagrisema sounds good in theory, but does it actually produce better weight loss results than the other GLP-1 drugs? Let's compare it against semaglutide and tirzepatide. This is a graph of semaglutide, commonly sold under the brand name Ozempic and Wegovy, showing that after about 1 year with the highest dosage of 2.4 milligrams, the average weight loss was approximately 15% of body weight. This is a graph of tirzepatide, commonly sold under the brand names Mounjaro and Zepbound, and its weight loss trajectory. As you can see, with the highest dose of 15 milligrams, the average weight loss after 72 weeks was approximately 20% of body weight. Now you might look at the graph and be a bit confused because there seems to be two different numbers. One with the line for 15 milligrams going down to 22.5% average weight loss, while there's another dot on the right side of the graph that says 20.9%. The difference is that the 20.9% includes all patients, including the ones that dropped out of the study. Therefore, the average is slightly lower, while the 22.5% did not include patients that dropped out. I will use 20.9% average weight loss as a conservative estimate. So how about Cagrisema? Well, a recent study of 3,417 adults that had obesity or were overweight with health-related conditions compared Cagrisema to placebo, and here are the results. After 68 weeks, the average weight loss was 20.4% of body weight. This is if we included all the patients in the study, including those patients that dropped out. If we only include the patients that completed the 68 weeks, this increased the average weight loss to 22.7% of body weight. So overall, the weight loss of Cagrisema seems to be better than semaglutide alone, but seems to be similar to tirzepatide. However, when you're evaluating a medicine, you don't only look at its benefits, but you also got to look at its side effect profile. The most common side effect of the GLP-1 family is nausea and vomiting, and Cagrisema seems to have the highest rate of this side effect. This is a graph of the percentage of patients that experience nausea and vomiting with each of the three medications. The blue bars are the percentage of patients that experience nausea, and the red bars are the percentage of patients that vomited while taking the respective medication. As you can see, Cagrisema has the highest rate of nausea and vomiting side effects, with 55% of patients, or more than half, experiencing nausea and 26.1% having some vomiting. Semaglutide actually shows a large variability in different studies on the incidence of nausea, but on average, about 30% of patients experience nausea and 17% for vomiting. Tirzepatide has the lowest incidence, around 23% for nausea and about 9% for vomiting. Fortunately, a large proportion of patients that experience these side effects are generally able to tolerate them and continue the medication. So in summary, Cagrisema is another evolution in the GLP-1 weight loss drugs and appears to be at least as effective as tirzepatide for weight loss, making it one of the strongest current available weight loss medications. The main weakness it appears to have is that it has a high incidence of nausea and vomiting side effects compared to the other GLP-1 drugs. At the time of recording this video, Cagrisema is still not commercially available. We will need to wait for regulatory review and long-term data in the real world to confirm findings. However, Cagrisema seems to be another powerful option in the treatment of weight loss. Please like and subscribe to the channel if you found it helpful. It will really help me out a lot. If you'd like to learn about a different non-injectable weight loss medication, check out this video here on Cagrisema, and I'll see you in the next video.